This course provides a comprehensive understanding of the physiological changes during terminal illness and equips CNAs with compassionate, practical skills to support patients and families during end-of-life and hospice care. Terminal illness marks the final phase of life where the body undergoes progressive decline. Hospice care focuses on comfort, dignity, and quality of life rather than cure. CNAs are essential in delivering holistic care addressing physical symptoms, emotional needs, spiritual concerns, and family support. This course explores body system changes in terminal illness and CNA responsibilities in hospice settings. First, comfort over cure, prioritizing relief of pain and symptoms rather than aggressive treatment. Next, holistic care, addressing physical, emotional, social, and spiritual needs. In addition, patient-centered approach, respecting patient choices and dignity. Moreover, interdisciplinary team, collaboration among nurses, CNAs, social workers, chaplains, and physicians. Equally important, family nurse support for families, recognizing families as integral to care, and providing bereavement support. Finally, the module also reviews CNA's critical role in delivering compassionate care aligned with hospice principles. Terminal illness causes progressive deterioration across body systems. CNAs must understand these changes to anticipate needs. To begin, the circulatory system is affected, with reduced cardiac output leading to fatigue, cold extremities, and in some cases, cyanosis. Moving on to the respiratory system, patients may develop irregular breathing patterns such as Cheyne-Stokes respiration, along with decreased oxygenation. Next, the digestive system often slows down, resulting in decreased appetite, nausea, dry mouth, and constipation. In addition, the musculoskeletal system weakens, causing muscle loss, reduced mobility, and a higher risk of developing pressure ulcers. Finally, the nervous system is impacted, which can lead to altered consciousness, confusion, restlessness, and changes in how pain is perceived. Altogether, these changes highlight the importance of recognizing and addressing symptoms early, so CNAs can provide comfort, preserve dignity, and support both patients and families during this stage of care. Now, effective symptom control is fundamental in hospice care. Pain management. First, recognizing verbal and nonverbal pain indicators is essential. Next, assisting with medication administration as delegated helps ensure relief. In addition, providing non-pharmacologic comfort measures such as repositioning and massage supports patient comfort. Other symptoms. Furthermore, managing dyspnea, shortness of breath, with oxygen therapy and positioning is important. Similarly, reducing nausea and vomiting through mouth care and dietary assistance provides additional comfort. Finally, addressing anxiety and agitation with calming techniques helps create a peaceful environment. CNA role, above all, close observation, timely reporting of symptom changes, and consistent comfort care are key responsibilities. Terminal illness affects mental and emotional well-being deeply. Therefore, it is essential for CNAs to provide compassionate support in multiple ways. Emotional support. To begin with, being present and listening empathetically allows patients to feel heard and valued. In addition, recognizing signs of depression, fear, or anger ensures that emotional struggles are not overlooked. Psychological care. Moreover, encouraging expression of feelings and fears gives patients a safe outlet. At the same time, providing reassurance and dignity helps maintain their sense of self-respect. Spiritual care. Equally important, respecting diverse beliefs and rituals honors the individuality of each patient. Furthermore, facilitating access to chaplains or spiritual advisors ensures that spiritual needs are met. Family support. Finally, recognizing family stress, offering resources, and including them in care decisions helps strengthen the support system around the patient. Let's talk about communication skills for sensitive conversations and support. In healthcare, the way we communicate can make all the difference. It builds trust and eases distress for patients and families. First, we focus on active listening. This means giving your full attention, using both verbal and nonverbal cues to show understanding. Next, we practice clear, compassionate language. By avoiding medical jargon and speaking with honesty yet gentleness, we create a safe space for patients to process information. Another important skill is supporting patient autonomy. This involves respecting their decisions and wishes, even when choices are difficult. We also need to be ready for dealing with difficult topics. Questions about death, fears, or unfinished business should be handled with sensitivity and care. Finally, strong team communication is essential. Coordinating with nurses and hospice team members ensures consistent, supportive messaging. In summary, these communication skills, listening, compassion, respect, sensitivity, and teamwork, help us provide not only medical care, but emotional support as well. Now, let's explore the important roles and responsibilities of certified nursing assistants, or CNAs, in hospice care. CNAs are at the heart of hands-on, day-to-day support for patients during this delicate stage. One key role is assisting with activities of daily living, such as bathing, dressing, and toileting, all done with gentleness and respect. CNAs also focus on symptom monitoring. This means carefully observing for signs of pain, discomfort, or respiratory changes. In addition, they provide comfort measures like proper positioning, mouth care, and skin care to prevent painful pressure ulcers. Equally important is their emotional presence, offering companionship and support that goes beyond physical care. Another responsibility is reporting. Timely communication of any changes or concerns to the care team helps ensure patient safety and comfort. And finally, CNAs are committed to respecting privacy and dignity, always upholding the rights of residents. In short, CNAs in hospice play a vital role, providing compassionate care, emotional presence, and constant respect for the dignity of those they serve. Next, let's look at cultural and ethical considerations in end-of-life care. Providing support during this time means more than medical treatment. It requires honoring diverse perspectives, beliefs, and values. First, we practice cultural sensitivity. This means understanding different beliefs about death, honoring rituals, and respecting how families approach decision-making. We also respect advance directives. These include living wills and do not resuscitate, or DNR orders, which guide care based on patient wishes. At times, caregivers face ethical dilemmas. These situations may involve conflicts between what the patient or family wants and what medical advice recommends. Navigating these requires compassion and integrity. Finally, it's important to remember maintaining professional boundaries. While empathy is essential, it must always be balanced with professional care and responsibility. In summary, cultural awareness, respect for directives, ethical decision-making, and professional boundaries all ensure that end-of-life care remains both compassionate and respectful. Now let's focus on supporting families and providing bereavement care. Families often experience profound grief during hospice, and CNAs play an important role in offering comfort and guidance. First, we start with recognizing family needs. This includes offering emotional support, sharing important information, and giving families moments of respite when needed. Next is facilitating family presence. Encouraging visits and involving families in care allows them to feel connected and reassured. Equally vital is bereavement support. CNAs can provide resources and compassionate comfort to help families cope after a patient's death. And finally, we must remember self-care for CNAs. Supporting families in grief can be emotionally challenging, so it's important for caregivers to manage their own well-being as well. In short, supporting families with empathy, guiding them through bereavement, and caring for yourself as a CNA ensures that hospice care extends beyond the patient, embracing the entire family. This course equips CNAs with knowledge and compassionate skills for terminal illness and hospice care. By understanding physiological changes, symptom management, emotional support, and cultural sensitivity, CNAs enhance the quality of life for patients and families during life's final phase.